Hi, I'm Dr. Margreet Wibbeling, midwife specialist and your host of the Birth and Baby show, brought to you by Sister Lillian Center and Sensitive Midwifery. We empower moms and midwives to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. Prego Omega Plus supports a daily diet, especially during pregnancy when there is an increased metabolic demand, and proper nutrition is essential to optimize the health of both mother and baby. Prego Omega Plus is a comprehensive 3-in-1 prenatal vitamin and mineral supplement that contains the active form of folate, calcium, iron, zinc, omega-3, and many other essential vitamins and minerals for mum and baby. Prego Omega should be taken prior to falling pregnant, as well as during pregnancy and whilst breastfeeding. Prego Omega Plus contains a month's supply of 3 tablets. 1 is the multivitamin and mineral tablets, that's the purple one. 2 is the omega-3 fish oil capsules, which is the gel capsule. And 3 is the calcium combination tablet, the yellow tablet. Hi everyone, thank you so much for tuning in again for a beautiful new episode. I'm very excited about this specific topic. It's very close to my heart. We're going to be talking about nutrition for the wanting to be mom and dad, or obviously for the mom and dad if you are pregnant. But nutrition is a big topic that needs a lot of attention. It can be confusing in the world out there where there are so many mixed messages when it comes to wellness and nutrition. And I found a very adequate speaker for this show, and her name is Jackie Niehaus. Jackie is a very knowledgeable wellness coach that I've even experienced myself. And she is from Cape Town, and she is the owner and founder of Wellness of Jackie. That is her website where you can find her. And we are going to be talking everything about nutrition. It's going to be not your average nutrition talk. Trust me, it's going to be very insightful. Enjoy this. Hi, Jackie. So nice to see you here in the online space. How are you doing?
Thanks, Margreet. It's great to be here. I'm doing well, thanks. And you?
Yeah, also really good. And I'm very excited about talking to you today. I know you have such nuggets to share with the world out there for women's health, but for just health and wellness in the for everyone, and from there into pregnancy and parenthood whatsoever. So very, very excited to have you. Thank you so much for agreeing to be on the show. Over to you. Tell us a little bit more about yourself.
Okay, great. So, hi everyone. I am Jackie, and I am a women's wellness coach. I actually come from a background in statistics. So, I did my master's degree in biostatistics, where my research thesis focused on modeling childhood growth outcomes based on prenatal risk factors. And I worked in the health and life insurance industry for a few years before I decided to really follow my passion of helping women overcome hormonal health struggles. So that's when I decided to get my qualification in nutritional therapy. And now I work one-on-one with ladies to really help them get to the root cause of their symptoms of hormonal dysregulation, which so often comes down to supporting their bodies better through better nutrition, through stress reduction, and other lifestyle interventions. So my goal in working with women is really to empower them to understand more about their bodies and about their hormone fluctuations and how they can support their bodies through better nutrition and better lifestyle practices for optimal hormone health.
That's amazing. Wow, what a beautiful journey you've had so far. I commend you for it and for what you're busy doing at the moment, because I do think it's extremely important. But having said that, food and wellness is really something that we get bombarded with. There's so much out there. If you're starting to do some research, there are so many messages out there, and it can really be challenging to navigate through the confusing messages. What is your experience with helping people on this journey to wellness?
Yeah, so I agree with you. There's so many conflicting messages out there in the wellness world. And I find, especially when it comes to women's hormone health, there's a lot of conflicting information. And I do find that a lot of those messages are quite restrictive. So you often hear messages like, cut out this food, cut out that food, cut out all these whole food groups. And I find that that can create quite a fear based mentality around food. And I have noticed that many women who struggle with symptoms of hormonal dysregulation already come from a background of having a negative relationship with food and have ended up undernourishing their bodies. So I'm quite careful with the language I use around nutrition, and I really prefer to encourage ladies to prioritize nourishment, asking how can they feed their bodies with love and with care by giving their body these nutrient dense foods that provide them with the vitamins and the minerals that they need to support optimal hormone health. And I've seen how that shift in perspective can make such a big difference in the way that a woman cares for her body, because she's no longer coming from it from a place of, diet being this form of punishment, but rather from a place of love and of care for her body.
Yeah, that's a very essential shift to make, I'm sure, but probably easier said than done sometimes. Um, how do you work with your women, and what are some of your key pillars when it comes to getting your approach?
Yeah, so I try to stay away from sort of diet dogma, and I really just prioritize, like I said, nourishment. And probably because I come from a background in statistics, I'm very data driven. So I do encourage ladies to collect a lot of data on their nutrition and their health, because I think that can be a great feedback tool and a great way for women to learn more about what their body's needs are. So I'm a big fan of doing food logging and food journaling. Again, not from a place of restriction or calorie counting, but more from a place to actually identify if you're meeting your body's needs. So I like to use an app called Chronometer, for example, which gives a nice breakdown of your micronutrient intake. And I encourage ladies to do some food logging and to start identifying gaps in their nutrition. Am I maybe under eating the B vitamins? Am I not getting enough zinc? Maybe I'm not getting enough magnesium. And to understand that all of those nutrients play a crucial role in our hormone health, because I always like to remind people that vitamins and minerals act as cofactors for every single enzymatic reaction that happens in the body. So every time your body makes a hormone, it requires certain vitamins and minerals. Every time your body needs to detox hormones that are in excess, it requires certain vitamins and minerals. So I think the first approach that we should take is making sure we're actually meeting those nutrient requirements of our body. And that's where something like food journaling can really come into play. And then the benefit with food journaling as well is we can get an idea of our macronutrient breakdown, which can go a long way to ensuring that you are balancing your blood sugar well. Because I put quite a big emphasis on blood sugar management, because blood sugar dysregulation can be a key driver in many symptoms that women experience around their hormones.
Wow, you said a lot of things there. That's wonderful. I love it that you take the as a root is that we need to nourish our bodies and nutrition as a whole. Like it's not in isolation. And I think sometimes we do think that like, oh, the doctor says I'm anemic, so I'm gonna take some more iron, or oh, I need a vitamin B injection because I feel so down. Or I mean, those are things that we've been actually okay with doing. Or oh, someone says magnesium is good, we'll take extra magnesium. So I think it can be quite, yeah, we need to, they all work together, and it's a nourishment in a bigger scope. So that's beautiful. And then how do you help women to make sure that they get their daily requirements of this nourishing? I know you say you track the nutrition, but food wise, or do you help them with food, or do you help them with more supplements? Because even the supplementation can be very overwhelming.
Yeah, so I always take a food first approach. I think the nutrients we're getting from food is always going to be in a much more bioavailable form than supplements. So, as far as possible, I think we should be trying to get most of our nutrients from food. And there's some specific foods that are just absolute superfoods when it comes to getting your nutrition in. And I think if you say the word superfood, a lot of people are thinking, green powders and chia seeds and all these sort of fancy superfoods that you're paying ridiculous amounts for in a health shop. But the superfoods I'm thinking of are not that at all. They're traditional, nourishing foods that are highly nutrient dense. So something like an egg, for example, so basic, but eggs are incredibly rich in nutrients. They're high in your fat soluble vitamins, B vitamins, protein, minerals. So I'm always encouraging ladies to eat eggs. Something like organ meat, and I know that might seem odd to people, organ meats really, but they really are one of the most nutrient dense foods on the planet. And I'm sure if anyone asks their granny or their great granny, they probably cooked foods like liver and kidney pretty regularly, but that practice has been quite lost on our generation, I find. So most people hear organ meats and they go, ew, I don't want to eat liver. But I think once we become accustomed to it, our palate becomes accustomed to it, we realize that our body craves those nutrients. And liver is one of the best sources of B vitamins, of iron, copper, selenium, zinc, fat soluble vitamins. So it really is an ultimate superfood. So I really like to take the approach of nourishing traditional old school foods, not sort of these new fancy superfood powders.
Yeah, that's amazing. Let's just for the listeners, you talk about bioavailability. That's the one thing I would love you to explain. And then also just, yeah, the beauty of having it from foods, like as you explained, from eggs and liver, because you've almost got like such a combination of elements, minerals, and vitamins all together. And because you did explain earlier, they do work all together to become absorbable in the body. Can you unpack that a little bit for those that don't understand that?
Yeah, so you had made the point about, people see low iron, so it's like, oh, just supplement iron, or low magnesium, just supplement magnesium. But all our nutrients work synergistically in the body. And in whole foods, you always find that perfect ratio of foods. So iron-rich foods, for example, usually do have some copper and some zinc, oftentimes vitamin A as well, because those all work together in the body to get iron where it needs to go in the body. And so that's the beauty of prioritizing foods first. In terms of bioavailability, oftentimes supplements are not in a form that's readily available for the body to use. And the body first has to make some conversions before it can actually use that nutrient. So, one of the examples I think many women are quite familiar with is folic acid. So, you often hear around pregnancy supplement folic acid. And it is incredibly important to get enough folate for pregnancy. But the form folic acid first has to be converted in the body to folate. And not everyone is that efficient at making that conversion. Whereas in whole foods, so foods like liver is a great source of folate, your green leafy vegetables are a great source of folate, legumes are a great source of folate. They already come in that bioavailable form that's ready for our body to use. And so that's why, again, I prioritize whole foods. I do think that supplements play a role. There are times where maybe we can't get the nutrients we need from food, or it's not available to us, or just a sort of a backup. But again, it's a supplement. It's a supplement to your diet. It's not replacing your diet.
Yeah, that's exactly it. So, yeah, I love that you unpack that, because that's so big on my heart is to not hide behind supplements and then just eat whatever, because you are
Yeah.
going to undo yourself, and the key is really what we eat and we put in our mouth. And I think it's a challenge in this day and age, and that's why I do think so many women are having a bit of a crisis sometimes with food. Yeah. So what are the challenges that you've experienced that women are dealing with implementing eating well in our day and age?
Yeah, I think one of the biggest challenges in many of the women I work with is that we're exposed to this image of what a ideal woman looks like, on covers of magazines, on all these places we see these models, right? And oftentimes these models that we're aspiring to be, we want to look like those models. They oftentimes aren't actually that healthy when you take a look behind the appearance. So, what defines a healthy woman? A healthy woman is a woman who has a regular menstrual cycle, who is fertile, who has clear skin, full of energy, sleeps well, healthy hair. But oftentimes that does come to get to that optimal place of being good for having good fertility. Women sometimes do require a little bit of a higher body fat percentage. So studies have shown that between around 22 to 30% body fat percentage is ideal for women in terms of fertility. But many of these models that we're aspiring to look like are way below 20% body fat. So the issue that I often see women run into is that they are over dieting in the attempts to look a certain way, which means they're not nourishing their bodies. They're not giving their bodies these really nourishing, nutrient dense foods that they really need. And that can often result in this diet binge cycle that many women find themselves in. And it's this negative relationship with food that we've developed. So that's a huge aspect of what I do, is changing the framework with which people approach nutrition. Again, it's not restriction, and it's not nutrition isn't there to punish your body. It's there to love, to care for your body, to give your body this nourishment, and taking maybe a step away from seeing diet as a way to control your body or control your image, and rather as a place to promote fertility, to promote a healthy hormone balance. So that's a huge aspect of how I work with women.
Yo, that's beautiful. I love it how you just described. I mean, that's nailing it. There is the body image and the picture of womanhood that we try to be, which is actually not the picture of true womanhood. We should be nourishers. We are life givers. I mean, when you fall pregnant, this most skinniest woman, thank God I fell pregnant first and foremost, but your body automatically, they gain the most weight because your body just needs that fat storage for pregnancy and all of that. So yeah, just to change a little bit of what society has believed as women should look like, that's really, really important. I'm sure that's a massive thing that women need to overcome. Yeah, great. So go with us to a shop. Go shopping with us. Just tell us what should be in our daily pantry.
Yeah, so I think getting a diverse range of animal and plant products is what provides us with optimal nourishment. So I try to stay away from extreme measures when it comes to nutrition, and rather promote a diverse range of foods that you can include in your diet. So as I mentioned, I'm a big fan of eggs. I'm a big fan of organ meats. Organ meats don't have to be eaten in excess. It's a little bit here and there, or maybe once or twice a month even. To get some organ meats is a great way to get some nutrition in. I do think that your meat products, chicken, beef, lamb, are providing you with good amounts of zinc, selenium, iron that we need. But then our plant foods, like our fruits and our veggies, are giving us a lot of vitamin C, a lot of potassium and other minerals that we need. So by getting that diverse range of foods, we're meeting all of our nutritional requirements.
Amazing. And how do you eat your liver and your organ meats?
I like to make a pate, so I'm a big fan of chicken liver pate, and I do like beef liver pate as well. Otherwise, even just lightly sear it with some onions and some garlic for flavor. I do think that we can make it quite palatable. It doesn't have to be this thing that we that we dislike eating, it can be quite nice when we learn to cook it.
Yeah. Since I've been made aware of the amazing sides of eating liver, my body's starting to crave it. It's quite interesting. So, Jackie, I know that we've been taught as healthcare professionals, and women have been taught if you're pregnant, you should not eat liver. And there's other things which you should not. Just give us a little bit of your insights on that.
Yeah, so the main reason for that is that liver is very high in vitamin A, and there have been studies to show that vitamin A in excess at toxic levels can contribute negatively to fetal development and cause some issues. And I think that's why there's been this sort of ban on liver during pregnancy. And while I understand that, I think that the misfortunate part about that is that you've taken out one of the most nutrient-dense foods that provide women with many of the essential nutrients you need during pregnancy, like folate, like your B vitamins, like iron and zinc. So I think the solution to that is to rather just eat your liver within safe limits. So to have enough liver to give you the nutrients without exceeding that vitamin A intake, you only need about 4 to 6 ounces of liver a week. So it's really not a lot. That could be a spread of pate every day. And that's providing enough vitamin A, because we also forget that vitamin A deficiency is also detrimental to pregnancy. It can also cause poor development in the baby, and many women are actually more at risk for vitamin A deficiency than they are of excess. So that's giving us an opportunity to get this bioavailable form of vitamin A without exceeding it, without overdoing it. So I think as long as you're eating your liver within reasonable limits, there isn't a concern about vitamin A toxicity.
Great. Yeah, it's quite high levels of vitamin A, and I think that's why we can't be on Roaccutane or something like that for your skin when you're pregnant and so forth. So yeah, thank you for clarifying that. That's really great. Other thing for note on pregnancy specifics is women are always being very made aware of the iron deficiency and taking extra iron tablets. You've touched on the folic acid. Thank you for that, and how it needs to change into folate in your body. It's very important. What is your take on iron and iron supplementation?
Yeah, so with iron, I think what we're often not taking into account of, like we mentioned earlier, no nutrient acts in isolation in the body. And just supplementing iron on its own, it often isn't actually correcting a deficiency. Firstly, a deficiency of iron in the blood doesn't necessarily mean that you're deficient in your whole body, because iron can store in the tissues. So it could be an issue of iron circulation in the body. And for that, we need iron's cofactor nutrients. So 2 of the key nutrients we need alongside iron are copper and retinol, because those help iron do its jobs in the body. And there has been research to show that eating liver, for example, is more effective at curing anemia than taking iron supplements on its own. And that's likely because liver is high in iron, copper, and retinol, as well as B12 and folate, which all play a role in anemia. So I think that's quite important to keep in mind. Many women who supplement iron experience quite negative symptoms like headaches. Severe constipation is the main symptom I've seen from women who supplement iron. And so we have to ask, are the iron supplements actually helping us or harming us then? And is there another way that we can give our body the iron that it does need during pregnancy, but with its cofactors in a more bioavailable form? And that's, again, why I am a fan of foods like liver, there's many ways to get iron in the diet. A red meat is a good source, but also some of your plant sources like spinach can be a good source. But that doesn't put us at risk of this heavy iron supplementation that many ladies end up doing.
So if I hear you, then if you should supplement, if you feel like you don't want to eat liver, or I can imagine our vegetarians or vegan mummies listening to this, then if you are thinking iron, then you have to think some other supplementation too. That's what I am hearing you, right? You've been talking about the cofactors for iron to be make it to be being able to be taken up in your body. So then they should supplement in a together form. Am I right?
Yeah. So if someone doesn't want to eat liver, I'd look at then other good forms of copper, because again, that's one of iron's cofactor nutrients that it needs to do its role in the body. And there are lots of vegetarian forms of copper. Mushrooms are a really great source. A lot of your citrus fruits are quite high in copper. And then I'd look at other whole food forms of retinol. So retinol is vitamin A in its pre-formed form. So it's very available for the body. And you find vitamin A in foods like eggs, egg yolks, butter, or other full-fat dairy is a good source of retinol. So there are other ways to get those nutrients in. And then, yeah, many foods do contain bioavailable iron. So it's getting that combination of foods in that can, I think, contribute the most to correcting an iron deficiency.
Amazing. Yeah. You did say the other word that I also want you to talk about, and that's dairy, because dairy has also been a very much attacked food source. Yeah. So let's tell us a little about dairy.
So I'm actually a huge fan of dairy. I went through a phase where I was concerned about dairy, particularly in regards to women's hormone health, because of potential hormonal implications. And I think that risk has been overblown. So I've really looked a lot into this research. There's very low levels of hormones left in the milk, and I don't think it has that much of an impact on us. And the risk with giving up dairy is that we're sacrificing a very, very nutrient dense food. So dairy is one of the best ways that we can get calcium. There are other food forms of calcium, but dairy is very bioavailable. And without dairy, I do find it quite difficult for women to actually meet their calcium requirements. It's also a really great source of B vitamins. It's a great source of fat-soluble vitamins, and it's a great source of protein. So when we give up dairy, and especially if you're replacing it for something like an almond milk or an oat milk, those alternatives aren't really nutrient dense. They actually contain very few nutrients. They're often mostly just water. And I think we've really given up an opportunity to nourish our bodies when we give up dairy. I do think that some people have an issue tolerating dairy. So oftentimes there's a gut issue that's hindering someone's ability to digest dairy well. But usually I find that gives us an indication that we need to work on the gut, that there's some gut work that needs to happen to get our gut into a good place. And then someone can start producing more of the enzymes we need to digest dairy. And usually people can tolerate dairy really well again. Also, I think a contributing factor is the quality of the dairy. So I do think if you can tolerate dairy and you want to incorporate it, it is worth looking for a good quality source. So preferably a farm where cows have been raised out on the pastures. That's going to make the milk a lot more nutrient dense. And often a lot more tolerable for people. So there's many factors that come into play with dairy if you're not tolerating it. But I do think most people can get to a place where they can tolerate it well and benefit from all those nutrients.
Sure, I think you have put a lot of people at ease by saying that. You certainly did for me. You also might have ruffled a few feathers because it's a confusing world out there. It's very, very confusing. I think the industry love to go onto these food fads. Like now all of a sudden it's all these plant-based milks and they're actually extremely expensive. And you just think you're doing your body better by having that option, not even knowing what's all in those packets of almond milk. I think that might even be questionable if that's so healthy for you.
Exactly.
Anyway, thank you so much for just simplifying it for us again and help us to go back to basics. Because originally, if you look at creation and what's all at play for food, those are the basics. It's not so complicated. I love working with our women, what I used to do in our NPO, and as a woman from low socioeconomic circumstances, and you think like, how can they nourish themselves well? And it's actually always hey, how did your grandmother used to eat? Just go back to those basics and you already will get most of it right. So yeah, no, wonderful. Jackie, I want to come for landing because there's so much we can say about it, but I want people to dig deeper and go find out about your work and read more and maybe even get a consultation with you to just help them to be guided if they feel like, yes, I know I need help. It can just be so helpful, someone to unpack your issues and get you on the right track. So where can people find you?
Yeah, great. Thanks, Margriet. Yeah, I encourage people who are considering getting pregnant to maybe consider working with me, because I put a huge focus on preconception preparation, which I think is often overlooked. I think we really need to place that emphasis on preparing before even trying to conceive by really nourishing our bodies well. So if someone is interested in working with me, they can go onto my website, which is wellnesswithjackie.co.za, or otherwise you can find me. I'm quite active on Instagram, also Wellness with Jackie. And yeah, you can schedule a free 15-minute consultation where I can just chat about what I do and if we align, and then we can make a consultation from there.
Awesome. So go check Jackie out. We'll put all your details also in the show notes. It's a really, really worthwhile investment and might help you really overcome some chronic issues that you might have been facing even. But that is a topic for another day. Jackie, thank you so much for all your time and all you do and your practical tips. You just make it really doable. Thank you.
Thanks, Margriet.
Yeah, keep up the good work.
Thank you.
Okay, we'll talk again.
Bye.
Bye. Thank you so much for joining us today. If you enjoyed this video, please share this with a friend who will benefit from this. And remember to subscribe and hit the bell icon so that you can be notified whenever we release new videos like this on our channel. We'd love to stay in touch and keep you updated with all our latest content and resources to equip and empower you. So if you're a midwife or any type of birth and baby worker, go to sensitivemidwifery.co.za/free gift. If you're a mom, visit sisterlillian.co.za/free gift for more training and resources. That way we can keep you up to date when we release new episodes like this, plus a few other bonuses. You can also find the links I just mentioned in the show notes. Remember, you're making a big difference because you are shaping the future of humankind. Thanks for watching, and I look forward to journeying with you.